So I'm interested in preventing falls, fractures, and functional decline for older adults, and I'm particularly interested in those living in long-term care and receiving home care. So I used to practice as a physiotherapist in long-term care, and when I was working in that setting, I started to realize that the care we were providing wasn't really optimized, and so that led me to go back, do a PhD, and get really interested in improving services in this area. So we know we have a growing aging population, and many of them live with complex chronic diseases and therefore require care in long-term care or in home care. And we know that rehabilitation has a role to play in preventing falls, fractures, and functional decline, but often people receiving home care or living in long-term care don't get access to rehabilitation. So I'm really passionate about improving access in this area. So we know falls, fractures, and functional decline can cause a lot of pain, disability, and can even lead to death. They also cost the healthcare system a lot of money and can reduce quality of life if they happen to people. So my research program is really trying to prevent those things from happening. So my research is mainly health services focused, so I use a variety of different methods, both quantitative and qualitative. So on the quantitative side of things, I often use routinely collected administrative data from healthcare settings like home care and long-term care. So those are big data sets of data that's kind of routinely collected in care. On the qualitative side of things, I'll often do interviews or focus groups with people to make sure that we get their perceptions on how health services are provided, and we also include their voice in the research. So I'm really excited about a project that we have going on right now that's funded by the Alzheimer's Society of Canada. And with this project, what we're doing is developing a rehabilitation program for long-term care residents living with moderate to severe dementia, because they're often excluded from rehab. So we're developing something specific for them. So we're kind of in the early days still in developing this, and then we're going to do a pilot test of it. But this is something I'm really excited to see what the results are going to be. So I look for someone who's curious, creative, and I think what's really important is kind of that persistence, because graduate school can be a little bit challenging sometimes. You have to learn new things, so being persistent is really, really important. So research is never a straight line. There's always things that go wrong. There's always things that come up. You can always think about things in a different way. So I think it's really important that people are curious, they're creative, they are persistent in trying to get things done, because things are always going to pop up. There's a saying that I really like that's, I forget who said it, but the saying is, if we knew what we were doing, it wouldn't be called research. So just kind of being okay with not necessarily knowing exactly how things are going, but still moving ahead. So I do a lot of work with administrative data, which is really large data sets. And with big data, we can answer big questions. We can look at things from policy all the way down to patient level factors that may increase the risk for falls, fractures, or functional decline. And so with that data, we can really answer some of those big questions. I also think that within Nova Scotia and here at Dalhousie, we have a lot of really great connections with the community. So there's lots of opportunity to have your research have impact on that community, because they can be involved right from the beginning of the project all the way through to the end. And you can see that your results will affect the people who you're working with.
What's your favorite random fact?
So I used to be really afraid of flying in airplanes, and so someone told me this, I don't know if it's true, but the fact is that more people are killed in donkey-related accidents than airplane crashes. So that just made it funny so that I could get on an airplane and not be scared.
If a genie could give you infinite amounts of one item, what would that item be?
I think it would probably have to be ice cream.
Which flavor?
I think cookies and cream.
As a pet, a tiger or a lion?
A tiger.
As a place to be, mountain or beach?
Beach.
What inspires you?
I think what inspires me is seeing people grow. So working with students, working with people around me, other colleagues, and watching them grow, watching them learn new things, and kind of working together towards a goal.